I'm Dr. Rishabh Singh, internal medicine resident at University of Illinois College of Medicine, Peoria. Today, I'll discuss my poster titled Secondary Hemophagocytic Lymphohistiocytosis, a Single Institution Experience. Hemophagocytic lymphohistiocytosis, or HLH, is a rare but potentially life-threatening condition where the immune system goes into hyperdrive, attacking the body's cells and causing severe inflammation. HLH can occur in two forms: a genetic or familial form, often affecting children, and a secondary form, which happens later in the life due to triggers like infections, cancer, or autoimmune diseases. The challenge with HLH is its overlap with other conditions, which makes diagnosis difficult. To guide clinicians, the HLH 2004 criteria was developed. These criteria require at least 5 of 8 key symptoms for diagnosis, including persistent fever, low blood counts, that is cytopenias, organ involvement, or high ferritin levels. Even with these criteria, diagnosing HLH, particularly in adults with secondary causes, remains a complex process. This study aims to provide more clarity on secondary HLH by retrospectively analyzing cases from a single institution. Our goal is to look at patient demographics, lab results, clinical presentations, and underlying causes, and assess how quickly treatment was started and which therapies were used. We hope this study adds valuable insights to understanding HLH in adults and helps improve management strategies for this condition. This was a retrospective study, meaning we looked back at patients' records. We reviewed adult patients diagnosed with HLH at OSF Ministry Healthcare. Using ICD-9 and ICD-10 diagnosis codes, we identified 36 potential patients. To be included in the study, patients had to be at least 18 years old and meet at least 5 of the 8 HLH 2004 diagnostic criteria. These criteria include high fever and enlarged spleen, and blood abnormalities like low hemoglobin, low platelet count, or high triglycerides. We also looked at the presence of hemophagocytosis in the bone marrow, decreased NK cell activity, and high ferritin levels. After reviewing the records, 11 patients met all the inclusion criteria and were selected for the final analysis. We gathered data on their demographic, lab results, and clinical symptoms and categorized them based on the cause of HLH. That is infection, autoimmune disease, malignancy, or unknown causes. Statistical methods, including multivariate analysis and logistic regression, were used to identify trends in the data. We also calculated an H score for each patient, which helped clinicians determine the likelihood of HLH based on lab values and clinical symptoms. Results. Of the 11 patients included in the analysis, we found that causes of HLH varied significantly. 3 patients developed HLH due to infections, 3 had autoimmune diseases, 4 had cancer-related HLH, and 1 cause was of unknown origin. The median age of patients was 52, but the age range differed depending on the cause. For example, patients with autoimmune triggers tended to be younger, with a median age of 25, while cancer-associated HLH affected older patients with a median age of 62. When looking at clinical symptoms, all patients met the criteria for low blood counts, elevated ferritin levels, and abnormal NK cell activity. Interestingly, not every patient showed the same outward symptoms. Splenomegaly or enlarged spleen was found in those with cancer or autoimmune-related HLH, but was absent in the unknown cause group. Fever was another common symptom, though it was missing in the case with an unknown cause. Elevated liver enzymes, LDH, and D-dimer levels were consistent findings across all patients, further indicating systemic inflammation. In terms of treatment, patients with infection-triggered HLH had mixed outcomes. One patient with HIV/AIDS and disseminated histoplasmosis survived after receiving antiretrovirals, itraconazole, and corticosteroids, while other patients did not do as well. All patients with autoimmune-triggered HLH survived. They were treated with corticosteroids and, in some cases, additional drugs like hydroxychloroquine or anakinra. However, the cancer-related HLH group had the highest mortality rate, with only 1 out of 4 patients surviving. This study highlights the complexity of HLH diagnosis and management, especially in adults. Autoimmune-related HLH had the best outcomes, with all patients surviving after timely treatment. On the other hand, infection and cancer-related HLH were more deadly, particularly the latter, where the mortality rate was 75%. Our findings emphasize the importance of early detection and quick treatment, particularly for malignancy-associated HLH, where delayed treatment often led to worse outcomes. In summary, this analysis provides valuable data on the clinical presentation, treatment, and outcomes of secondary HLH in adults. Moving forward, we hope these insights can help refine diagnostic and therapeutic approaches for this serious and life-threatening condition.